Ever get that feeling, when you're just scrolling through the news and bam, you hit a headline that makes you stop in your tracks? It's me, right now, with this KVN24 article you sent. Hamburg, Germany. Right, not exactly the first place it leaps to mind when you think Marburg virus. Ooh. But here we are, two people, detained. Authorities worried about a potential outbreak. It's like ripped from the headlines, right? And it gets even more, I don't know, intense. These individuals, they just come from Rwanda. Possible exposure there, and get this, one of them starts feeling sick on a train, packed with passengers no less. So they end up in Hamburg seeking help, and suddenly it's all hands on deck. So before we even get into the why Hamburg, why the massive concern, we got to break this down. What is Marburg virus and why are health authorities freaking out? I need some expert backup on this one.
So Marburg virus, it's, how do I put this? It's nasty. We're talking about hemorrhagic fever and not the kind you walk off.
Okay, so bad, we got that. But just how bad are we talking? Like, what's making this such a five-alarm fire for health officials?
Well, for starters, the fatality rate, it can be as high as 90% in some outbreaks.
90? Seriously, that's not good at all. So what makes Marburg so deadly so quickly?
It's aggressive, like really aggressive. High fever, muscle pain, you literally start bleeding inside and out. The article, it even says patients don't look like ghosts, which I gotta say is pretty haunting.
Yeah, not exactly the visual you want. And that description, I don't know why, but it instantly made me think of Ebola. Am I way off base there?
Not at all. They're actually related, both part of the Filoviridae family. Same kind of nasty symptoms spread through bodily fluids, the works.
So like cousins in the virus world, and not the fun kind.
Pretty much, though there are some differences. Where they come from, how they jump from animals to humans. Marburg's mostly from those fruit bats in Africa. Ebola, that's got bats and primates in the mix.
Okay, so different family trees, but same deadly outcome. Which I guess makes containing this thing, especially in a place like Hamburg, incredibly tough.
Understatement. Think about it. One of the individuals in Hamburg, they're a medical student. They've been traveling. So that's Rwanda, already dealing with an outbreak. Then through a major airport like Frankfurt, then on a train. It's like a contagion roadmap almost.
And with each stop, the chances of spreading this thing just multiply.
Right. And this is where it gets even trickier. The article mentions healthcare workers in Rwanda getting infected too.
Which, I'm no expert, but if the people trained to deal with this are getting sick, that can't be good.
It's a huge red flag. It means this thing spreads easily, even in a controlled environment. Makes you think twice about those travel plans, right?
Maybe just stay put for a bit.
Uh,
Yeah, I'm officially spooked. But before I swear off travel forever, let's, try to rationalize this a little. What's the actual risk here? Should we all be prepping for a Marburg apocalypse?
Let's not get ahead of ourselves. Panic helps nobody.
Right, of course. Stay calm. Easy for you to say, you're the expert.
But seriously, the situation in Hamburg, it's definitely something to watch, but it's not a lost cause. They acted fast, isolated those individuals, and the contact tracing's underway. That's crucial.
Contact tracing, that's got to be like finding a needle in a haystack, right? Especially with international flights, trains, all of that.
It's a huge operation for sure. We're talking 275 passengers on that train alone, plus whoever they might have interacted with at the airport in Frankfurt. It's a logistical puzzle, and the clock's ticking.
So they're just, calling every single person? How does that even work?
It's a combination of things. Passenger manifests, surveillance footage, maybe even credit card records, anything to retrace their steps and find those potential exposures. And it's not just about finding them, it's about making sure they're monitored, tested if needed. It's a massive effort, incredibly resource intensive.
Makes you realize all that public health stuff, it's kind of important, huh?
Absolutely vital. And what we're seeing play out in Hamburg, it's a prime example. It's a stark reminder this isn't just about reacting to outbreaks, it's about preventing them. Surveillance, early detection, those are the keys.
So, yeah, this whole situation, it's scary, but it also shows we're not totally powerless.
Right. Knowledge is power. And being aware, staying informed, that's our best defense. This might feel very close to home right now, but it highlights a bigger issue. These health threats, they're global. We need everyone working together, sharing information to stay ahead of the curve.
Global cooperation, public awareness. Got it. Well, that's about all the time we have for today's deep dive.
Stay safe out there.
And for our listeners, if you're feeling a little more curious, a little less of panic, head over to our show notes. We've got links to the WHO, CDC, all the good stuff. Until next time, keep those brains engaged.